Welcome back. I am excited to talk to you today. Last week, as you know, we talked a little bit about Botox and Dysport and what those medications are and what they can do. Today, I want to dive into the actual treatment process. So I'm Rebecca Kelly. I'm a board certified nurse practitioner. I am the owner of AIYANA Aesthetics. We are a med spa and wellness center in Oregon, and let's dive in. So the treatment process of Botox and Dysport is something that we do every single time a patient comes in. But like we mentioned last time, what are Botox and Dysport? Let's touch on that real quick because again, they're wrinkle relaxers. They're going to help relax the muscles so that when you go to make expressions, smile, you're not going to have all those deep fine lines and wrinkles. So let's dive into the treatment process. So the first thing that we do when our patients come in is a consultation. Consultations are imperative. We want to make sure we dive into your medical history. We talk about what concerns you the most. When you look in a mirror, we actually do have you look in a mirror so that you can kind of look at your face and see, you know, that really deep scowl line really bothers me, and my mom had it and my grandma had it and I just don't love it. Is there anything we can do about it? I'm always encouraging my patients to tell me what concerns them. I do have patients, however, that come in and they say, you tell me what to do. And I really don't like that question because the honest truth is it doesn't really matter what I see. What I see is irrelevant because you are the one that's looking in the mirror every day. You are the one that's going to need to make that decision of what concerns you the most. And I always tell my patients that let's start with what concerns you the most and then we'll build upon that. So don't get too overwhelmed with the overall picture. We're going to start slow and we're going to get rid of what concerns you the most and kind of help that area out, and then we can move on from there. So the consultation is imperative. I always like to see if anybody has any history of headaches and migraines, if they have any TMJ concerns like we talked about last time, or any other concerns that they might have. Of course, knowing about their medical conditions. If they have any neuromuscular or neurological conditions, that's very important for us to know. And then also to know if they've had any issues with Botox or Dysport in the past. So consultation is so important. That's step number one. Number two, the treatment process is we're gonna actually talk about the injection itself. So when we inject Botox or Dysport, we're injecting it in different areas on the face, even the neck, to help relax the muscles. So I like to walk people through what's going to happen with the injections. And one of the things that we always talk about is that kind of what can happen after the injections occur. So of course we're sticking needles in your face, so there's always a chance of bruising. I always tell my patients, expect a bruise. If you don't get one, that's incredible, but we are so vascular in our face that there is a chance of bruising. You're also gonna have some redness and irritation in those areas that we injected. So it's important to know that immediately after the injection, it might be a little red, it might be a little irritated. You can always put on a little bit of makeup, but that can last for about an hour. Another thing I like to talk to my patients about is, for the next 4 hours, we don't want you pressing on the area or, going to get a massage or even getting your lashes done. Because if you press on those muscles that have been injected, the medication can move. And so we want to make sure where we injected it, it actually stays. And then another thing is that one side can kick in before the other. Usually the patient is the only one that's going to notice that, and it typically only lasts about 24 hours, but it is certainly something that can happen. So the other thing that I like to talk about is making sure that the patient understands that it can take up to 2 weeks for the medication to fully kick in. So be patient. We always check in with our patients at the 2-week mark to make sure that they're happy, that everything looks good. We don't have any crazy Spock brows or any dropped eyebrows. We want to make sure that everything looks just as we were saying that it will look after the treatment. Okay, so of course it is important that you see a skilled injector, that you are making sure that you vet the people who are doing these injections. You want to have a nurse injector or a medical professional performing this who has years of experience. I think it's always important to make sure that you ask them, how many times have they done this, and just making sure that you feel comfortable with your injector. One tip that I always tell my patients, if you walk into the consult and you look at your injector and the way that she looks is not in line with the way you would like to look going forward, you need to just wrap up that consult and go find somebody else. All right, that is everything. So thank you so much for joining me today. Make sure that you like and comment below, share this with your friends, and subscribe. And we'll see you next week when we dive into a little bit more about Botox and Dysport.